Hello, I'm going to be demonstrating how to put in a primary infusion line. Then I will also be demonstrating how to put in a piggyback for that, and then also how to do a IV push during a continuous infusion line. So I'm going to begin with having collected all of the items that I'm going to need. I've got my IV bag, I've got my IV tubing, I have gloves in my hand, and I have alcohol swabs and a flush. So I'll begin by performing hand hygiene and then putting on my gloves. I have already performed my first and second check at the MAR when I collected all my stuff. I checked the expiration date of the IV bag and check the compatibility for what my patient is having. So I brought that all into the room. The first thing I'm going to do is use two patient identifiers for my patient, name and date of birth. Then I will be performing my third check, so I'd be comparing what I have on my MAR to the different items that I already brought in. I'm going to check my patient for allergies, see if they have any allergies, and then also check their IV site, see if there's any infiltration or anything like that. So, got my IV bag over here, and I'm looking to put in normal saline with an order of 100 milliliters per hour. So I have my bag over here. I have my tubing. Got that all ready. It's out of its packaging. Place that on the table. The next thing I'm going to do is on the port for my patient, I'm going to scrub that for 15 seconds with this alcohol swab. So I'm scrubbing it right now. Let's say I did it for 15 seconds. Done. Then I'm going to take one of these flushes, open it, get rid of the air bubble that's in the flush. Okay, and then attach the flush to the IV port that's attached to my patient. I am going to check the patency, draw blood return, and then I'm going to flush with 10 mLs, or 5 mLs. Okay, so it's been flushed. I'm going to keep the flush on the port just to keep that sterile. Next, I'm going to spike my bag. So, remove this tab from it, making sure that I don't touch the tip over there. Remove this little sheath on my tubing. And put this over here. And then, so I got my bag. It's hanging. I'm going to spike my bag. Making sure that I've clamped this tubing on the end before I start any of this. So, spiking the bag. Bag has been spiked. Next thing I'm going to do is fill up the drip chamber till it is a third or half full. Okay, now I am going to prime the bag. Prime the tubing. So take that down, and then unclamp this. Follow the line as it exits. Make sure all those bubbles exit. Okay, there we go. And then I'm going to clamp it again. take off this tab, paper tab. Okay, then I'm going to remove the flush that I have attached to my patient. And then attach this into it, the tubing. Okay, now I will program that. System on. Open this up. And insert. New patient, med-surg, yes. Then patient ID 33333, confirm. Line A. Oh. Channel select. Channel select, guardrails IV fluid. Then I'm going to go page down until I see 0.9% normal saline. I'm going to click yes, and the rate is going to be, what I have ordered here is 100 ml per hour. And then the volume to be infused is going to be it's going to be 100 mLs. And I will start the line, making sure that I have this not clamped. And I am going to watch for the first drop. There it is. There's the first drop.